Europeans in general are living longer and healthier lives than ever before. Healthcare services provided throughout the EU are, generally speaking, of high quality. Citizens prefer to receive the care they need close to their home. However, sometimes it's better or easier for them to receive healthcare abroad. In a 2007 survey, 4% of European citizens said they'd received medical treatment abroad in 2006. What's the reason for this? In Frankfurt, for example, Professor Wagner, a renowned pneumologist, treats patients from other countries.
Wenn man unsere Patienten betrachtet, dann sieht man, dass etwa
About 5% of our patients here in Frankfurt come from other European countries. They come for special consultations or for a particular treatment. In need of a special lung operation, Luca Onorante left Italy to come to Germany. He wanted to be treated by one of the best surgeons in the field, who is a specialist in his condition.
Ho avuto un problema polmonare e ho avuto...
I had a pulmonary problem and it needed a specialist.
I miei medici italiani mi hanno...
So I consulted my doctor in Italy, and he advised me to come here to Frankfurt to see Professor Wagner.
Vi è stata la necessità di un intervento chirurgico.
This was because my condition needed an operation, and it had to be done by an expert in the field. The need for certain treatment leads some patients to go abroad. In other cases, the hospital just across the border is closer to where the patient lives. As confirmed by the European Court of Justice, citizens have a right to access healthcare in another member state, and for the reimbursement of costs of such a treatment if certain conditions are fulfilled. To improve cross-border care and to make the rules clearer, the European Commission is proposing a better defined framework for everyone involved in cross-border healthcare, patients and healthcare providers.
She's coming from Haarlem, which is quite far.
On one hand, we have the established right of the patients to be able to receive treatment in another member state and be reimbursed. And this we're trying now for this to offer legal clarity and legal certainty through a proposal for a directive.
An hour later, after I had the discussion with...
Although cross-border treatment for patients should be problem-free, Joseph Caruana from Malta had a quite different experience. Having tried various EU countries, he finally found the best treatment in the Netherlands, at the University Hospital in Maastricht.
It is a major operation, which is a total replacement of the aorta. I cannot expect Malta to have the facilities or the financial strength to do these operations. It doesn't make sense. So I expect to take advantage in centers like this, where they do an operation a week of my type for these people.
The European Commission's draft directive will bring clarity about when a patient is allowed to receive treatment abroad and have it reimbursed. And it will make clear who's responsible to ensure quality and safety of care, including in cross-border settings. Giving patients access to the most appropriate treatment does not necessarily mean they have to travel from one country to another. On a visit to the Maastricht hospital, Commissioner Ciprianu was able to watch a demonstration of telemedicine. Thanks to telecommunications technology, the operation by a doctor in Germany was monitored by a specialist in the hospital of Maastricht.
We also want to create centers of excellence which can offer expertise not only on location but also in other areas through the use of information technology and exchange of best practices. So this expertise that cannot always be acquired everywhere can be shared with different medical centers all over the European Union.
Indeed, Professor Wagner himself heads up a network of European experts guaranteeing a high level of diagnostic quality.
Zum einen ist es ein Expertennetzwerk für Patienten mit Mukoviszidose.
Basically, it's a network of experts specializing in the treatment of mucoviscidosis or cystic fibrosis. And their mission is to make information available. And as members of the network, they should answer questions from doctors and patients. And this regardless of the member state in which the problem has occurred. The principle is this: European specialists can talk to each other via an internet forum to exchange points of view and provide a complete diagnosis to the patient. It's therefore no longer the patient who travels, but the information. This concept is at the very heart of a Danish initiative on cross-border healthcare collaboration, the Baltic e-Health Project, undertaken by the hospital at Funen in the south of the country and co-financed by the European Commission. The Funen Hospital covers a major geographical area with a rather aging population, and they tend to suffer from serious illnesses and chronic diseases. Faced with a heavy demand for healthcare and, importantly, a lack of local practitioners, the establishment of a pilot project such as Baltic e-Health makes good sense. The purpose of Baltic e-Health consists of finding a technical solution for connecting the healthcare data network of Norway, Sweden and Denmark to the healthcare data network of Estonia and Lithuania. This will then be used for serving the clinical side, where we can send general X-rays, for instance, to and from countries. An example. Leo Bjarne Hansen, a 70-year-old with a problem in his right knee, has an X-ray in Funen. The result is provided to an Estonian radiologist on a server, and he'll make a diagnosis in his own language using a template. Thanks to the system, it's instantly translated into Danish. As you can observe here, the answer from Estonia has arrived. You see, I've received an answer about the examination requested by a local doctor. I'm confident in what doctors do here, and I think it's a good idea that they can correspond with their colleagues and other specialists abroad. It puts me at ease. Cross-border healthcare can be beneficial to all: patients, doctors, hospitals, health systems. The European Commission is aiming to make clear the conditions under which treatment abroad can be reimbursed, and also to clarify where the responsibility for the quality and safety of healthcare lies. The December 2007 launch of a draft directive is an important step to achieve these goals.